Each school has a plan for handling the flu virus. You should check with your school to find your specific procedures.
If my kids have the flu, when is it okay for them to go back to school?
Well, first of all, a parent, if they suspect that their child has flu-like symptoms, then they need to keep that child home.
Tom Chagnon is the superintendent of schools for Stanislaus County. He notes that procedures are in place if a student or faculty member becomes ill while at school.
The schools have been instructed to try to remove either the staff member or the child from the rest of the student body. Most of them have a little space up near their office, and they wait there until they're able to be picked up by a parent or they're able to get home.
Children should not go to school if they have influenza-like illness symptoms. So if they run a fever, they should not be going to school. They should not go back to school until their fever's been gone for 24 hours without the aid of fever-reducing medications.
Careful study has demonstrated that not only are school children at risk for receiving the disease, but also at risk of transmitting the disease.
You can have one student with influenza, and with seasonal influenza, maybe a couple other, 3 or 4 other students in a classroom of 30 will have it. With H1N1, it seems to be more contagious. You get one student with it, and all of a sudden half the class has it.
We want students to be in school. Healthy children need to be in school. That's the message that we'd like to give to parents.
Businesses as well need to be looking ahead as to the impact of the flu season.
I think it's very important for business owners to plan ahead.
Businesses can look at cross-training employees, planning for vacant positions, and even looking at staff working from home if illness spreads.
But I think one of the most important things that business owners need to recognize is that if staff come to work sick, that exposes the other staff members. So it's really important to encourage sick staff members to stay home until they're well.
If prevention is a key, what about flu vaccines? Do you get the seasonal flu vaccine, the H1N1 vaccine, or both?
Well, the recommendation is that you get both vaccinations because the reality is that flu symptoms, whether it's seasonal flu that we're used to or the H1N1, the symptoms are quite similar. And you can have a mild disease or a severe disease.
The CDC recommends the following people receive an H1N1 vaccine if possible: pregnant women, household contacts of children under 6 months, healthcare and emergency personnel, and persons aged 24 to 65 who have health conditions associated with higher risk of medical complications from influenza. So what should people remember when they cough?
Proper cough etiquette is to not cough into other people's faces, cough into a tissue and then wash your hands, or cough into your elbow.
You should also avoid touching eyes, nose, and mouth to prevent the spread of the disease. Try to avoid close contact with sick people. And you should also be planning ahead.
I think one of the important things, because a large portion of the population is going to be sick with this, is to have some kind of contingency plan. So for parents, a lot of them are, both parents work. So if a kid gets sick, who's going to stay home and watch them? They can't go to school. And so just having that mindset, kind of thinking, okay, do we have a plan in place? What are we going to do if somebody gets sick?
But the most important thing you can do to prevent the spread of disease is probably one of the easiest.
The number one thing to do to prevent any disease is hand washing, in capital letters.
Wash your hands. Sneeze into your elbow and wash your hands.
After you touch surfaces, before you touch food, before you rub your eyes, anything like that, wash your hands.
Use warm water and soap when washing your hands. It should take between 15 to 20 seconds. If soap and water aren't available, you can use alcohol-based hand sanitizers. And Dr. Bauman has a tip for parents.
Parents should probably carry a little bottle of those around with them. So going out to a restaurant, those kids can get their hands wiped off so they're not putting germs into their mouth.
Also, it's important to maintain good health habits during flu season. Eat healthy foods and get plenty of rest. But if you do get sick with the flu, you need to know what to do.
If you have any condition which might make you prone to having complications from the flu, that would be both seasonal flu and H1N1. If you're pregnant, If you have some other medical condition like asthma or diabetes, if you're undergoing treatment that makes your immune system not work as well, like you have a cancer diagnosis or something like that, immediately call your doctor.
There are also things you can do to help feel better if you get the flu.
It's important to stay hydrated when you have a fever, so drink plenty of fluids. Okay to take Tylenol or ibuprofen. It's important to eat, because a lot of people tend to drink a lot of fluids and don't eat when they're sick, and of course that can be as destructive as not drinking enough fluids.
Children with flu can have even higher fevers.
With the H1N1 flu, fever can be pretty high, even 104 or higher. And usually it's going to last 2 to 3 days on average. The fever is the body's mechanism of helping to fight off this virus, so in some ways it's a good thing. It just makes us feel miserable, and that's why we treat it. Not because the fever is dangerous, but because you feel really icky.
You're infectious while you have the fever, and you should stay home. You should isolate yourself as much as possible in a separate room from other people. In most cases, you can return to work after you've not had a fever for 24 hours without the aid of fever-reducing medications.
Most people who get the flu will not need an H1N1 test unless they're hospitalized. But for some cases of H1N1, you might need to get an antiviral treatment from your doctor.
Antivirals are, in essence, an antibiotic for the influenza virus.
Antivirals are prescription drugs to be used cautiously and appropriately. In general, according to the CDC, priority for antivirals will be given to people hospitalized with influenza or those at increased risk for influenza complications.
So although it has value when used effectively, it should only be used under a doctor's very clear guidance and only for those who really need it. The vast majority of us who develop influenza don't need it.
But if it doesn't seem like you're getting better, what should you do?
You can wait 3 days, 4 days. If you're not getting any improvement in your symptoms, call your doctor.
If they're throwing up all the time, can't keep anything down, they're at risk of being dehydrated. In older kids, maybe some dizziness, lightheadedness, confusion would be signs of some dehydration as well.
Also, if your flu symptoms return after having gone away, call your physician. Most cases of the flu won't be life-threatening, so it won't be necessary to go to an emergency room.
I tell people, though, don't go if you've got the regular flu. When you go to the emergency room, you're just exposed to 60 other people in the waiting room. You have the potential of infecting half the county that way.
However, experts warn there are signs when emergency treatment might be necessary.
There are some warning signs for folks to look at. The two main things are breathing difficulty. So in a kid, it may just be very rapid breathing, or their chest is sinking in, they're having difficulty. If there's color change, so they're bluish color around the lips or they're gray, certainly those things would be an emergency that we would need to see right away.
If they're having a lot of shortness of breath, can't catch their breath, if their family looks at them and says, your color's really bad, kind of the standard things we'd think of, you need to be in the emergency department right now, go to the emergency room.
Very few people will have the extreme illness, with most cases showing the same flu symptoms seen every year. So while the flu is unpleasant and uncomfortable, there are things you can do to help you get by.
You're going to have some of those symptoms, and it's kind of standard flu. Ride it out as best you can.
Because the reality is, for most people, you're going to have mild to moderate influenza. However, there is a fairly sizable group within our population who are at unusual risk, and we really want to protect them. Don't be scared, be prepared.
When you cut through all the hype, you're confronted with the reality of the H1N1 flu. And the reality is that any flu can be deadly and needs to be taken seriously. You can do your part by taking appropriate precautions to protect yourself, your family, and your community. So let's do what we can together to make a difference.